Hey everybody, this is Chad Madden, and we're getting ready for Bootcamp here. Today I have a very special guest who's also going to be at Bootcamp San Diego with us. His name is Ryan Tabaka. Now, it took me about 30 seconds to understand how to pronounce this name. So really quick, Ryan is with Squid Compression. They have an awesome product. It's super affordable, and if you're anything like I am, where we're running 500 visits a week, we have multiple patients that need the cold or compression machine at the same time. It's a big headache. They've solved this problem for you. So I'm really excited for you to introduce Ryan. And as we get started here, Ryan, can you just give us the history on your name that you gave me here a few minutes ago, because it's awesome.
I certainly can. So yes, thanks for having me. I appreciate being here. Not very often I'm called a special guest, so I appreciate that introduction. But yes, Ryan Tabaka, Polish descent. Used to be Tabazinski originally, and they shortened it to make it a little easier. And the best thing they could come up with was Tabaka, which people still can't pronounce. Frankly, as I said, if someone does pronounce my name correctly and I don't recognize them, it makes me a little nervous because they must have met me somewhere along the lines. But for those people I'm meeting for the first time, I simply tell them it's like Tabaka cake without the cake. And that's something that usually sticks in people's minds and makes it a little bit easier.
Yeah, I got it, man. Tabaka. Yeah, cool. Awesome stuff. So you're in charge of sales distribution for Squid Compression. I know you and I talked a little bit, Ryan, about what exactly it is and how it's different. I know you have a lot of expression in cold and compression therapies. Can you talk a little bit about the difference between Squid Compression, what you're offering, and everything else that's out there on the market?
Yeah, certainly can. And as most of the viewers know, cold therapy is an integral part of most rehab regimens. And so it's everything from a bag of ice and a gel pack that you're giving right there in the clinic, or in many cases, frankly, if it's just ice, you're saying, here's a bag of ice, take it home and use it when you get home. Now, over the years, we have progressed a little bit, and now we have products that offer true cold and compression. So what Squid ventured to do is come up with a product that's higher quality, offers a little different compression than most, and at a price point that most people could afford. So what we do is, and I've got the pump here, so this is literally all there is to the pump, because rather than filling it with ice and water or using a thermoelectric system like some do, we use simple gel packs. So for the cold, we have developed proprietary gel packs to provide the cold therapy. They simply Velcro right into the wrap. And then this pump provides the compression. Now, the big difference with our compression and most other products is we offer true distal to proximal sequential compression. So a lot of the cold and compression products, it's uniform compression. I compare it to a blood pressure cuff. So the whole wrap constricts simultaneously, and it pushes the fluids in both directions. What we have done is developed a product that provides true distal to proximal compression, which simply pushes all the fluids in that one direction towards the heart, which actually enhances the recovery. So we've got a product that's extremely high quality, portable, easy to use, simple gel packs than messy ice and water, better compression, and frankly at a price that more people can afford.
That's awesome, because I know one thing that I look at as an owner is ROI. And I know we have like the old 1980s clunky, we still have it. I'm not sure why I'm saving it. It should be in a museum.
Yep.
But
you'd be surprised. There's a lot of them out there still.
I don't think we've hooked it up in 5 years, but basically it blows up. It provides a ton of compression, and then the compression just goes away and it cycles off and on. And from what I understand with your system, we could, rather than just putting a cold pack on somebody and basically we don't get any money for that at all. Although there is a therapeutic benefit there with your system, we could be doing that, and it's affordable enough where we could have 5 of them in the clinic at the same time running and not just sitting in the corner collecting dust.
Well, yeah, and that's the big thing is, and I always joke, especially with your private practice clinic owner, you try to walk that line every day between quality patient care and keeping the lights on. And that becomes harder and harder, it seems like, every day. But again, as I mentioned, cold therapy still is, most everyone still uses it. So products like the Squid, and thankfully too, the old Job's pumps and those pumps back in the day, that there's a code now that you can bill for the compression as long as there's an internal pump that provides active compression. In many cases, we're able to bill insurance companies for that compression. You don't get reimbursed typically for the cold, but in most cases around the country, we're still able to bill under that vasopneumatic compression code. It's a simple 15-minute treatment. Obviously, the reimbursement varies by geography and by carrier, but more often than not, there's a pretty nice ROI component in addition to the quality patient care that you're providing.
Awesome. So you're going to have units at Bootcamp?
I will. People don't come by my booth to see my smiling face, believe it or not. So I will actually have a pump. I'll have all the different wraps. I'll have gel packs that are cold and ready to go. And I'd love for people to stop by, and I can throw it on you just for a few minutes. The proof's in the pudding, right, is what I tell people. And I'll have them there. You can try them on and decide for yourself if you think it's something that your patients would benefit from.
That's awesome. So I'll make a promise right now. I'm going to be at your booth. We're going to try it on. We'll do a live broadcast from there. So for those of you that are listening, make sure you check it out. Squid compression at Bootcamp San Diego with Ryan Tabaka Cake. Right.
And he also said he would buy one as well for you listening. Remember that.
Yeah, that's right on. Buy one, get one free. Get one on me. Right?
Yeah, that's right.
Awesome, man. We'll see you in San Diego.
I appreciate it. I look forward to it. Thanks to everyone.
Thanks, Ryan.